I'm Jen Nelson, and I work at Mental Health Partners as part of the crisis counseling program team. And thanks for joining me here for a YouTube event. And I have a few things that I wanted to bring to you to talk about supporting children's mental health, especially during the time of COVID and after. So I want to talk a little bit about what the effect is of COVID-19 having on our kids, and to discuss some simple strategies that we can implement to support children's mental health. So if you think about what your child has experienced during the last year, I'm sure that you have some evidence that they've been really struggling. They might be a little bit more anxious, they might be a little bit more clingy, have trouble separating from you, maybe having resistance to going to school, possibly having less activities that they're doing or that they're interested in. And all of this is very normal and a very understandable reaction to the pandemic and the last year's trauma that they've experienced. So as a parent, you've experienced a little bit more anxiety as well. I'm sure parenting is much tougher now than it has been. Over the last year, you've been asked to be your child's teacher, caregiver, schedule planner, activity planner, chef, all of the things that you've done before, and then adding teaching to that, and also managing their stress levels with what could be possibly your stress level as well. So the American Psychological Association, the APA, has done a few studies, and it's recognized that the level of stress for parents during the pandemic and after has gone up significantly. There was a study done recently that showed that 75% of parents expressed that they did not get the emotional support that they needed over the last year. So despite the fact that you are under additional stress and feeling just the anxiety and all of the things that have come to you over the last year, your kids need you more than ever. COVID-19 is being considered an adverse life experience that could impact your children for the rest of their lives. An adverse childhood experience is very significant, and it's important that they're addressed and the effects mitigated as much as possible. So I wanted to talk a little bit about what the ACEs are. Adverse childhood experience is a survey that was done. The Center for Disease Control and Kaiser Permanente conducted a study from 1995 to 1997, and they called it Adverse Childhood Experiences. Prior to this study, they had observed children who had experienced certain adverse experiences in their youth ended up having repercussions that lasted well into adulthood. So the CDC and Kaiser Permanente created a survey with 10 questions about events that had occurred during childhood of some of the survey participants. So these questions covered 3 broad categories. This looked at abuse, neglect, and other experiences that happen in the household, like household dysfunction. And they found that people who had experienced these issues in childhood had a greater risk of having numerous kinds of struggles in adolescence and adulthood. They had a greater risk of substance abuse, relationship struggles, physical and mental wellness, and finding secure employment. The higher number of ACEs that someone has, the higher risk of difficulty in these areas. Now, this study was pivotal in predicting life satisfaction and success. So many of us had at least 1 or 2 of these ACEs growing up. Between 2011 and 2014, the CDC discovered that about 62% of people studied at random had at least one of these adverse experiences as a child. And now if we're looking at COVID-19 being added to this, then all children have at least one ACE. So many researchers in pediatrics and the mental health field, including Harvard Medical School, are considering COVID-19 a new ACEs event for children. That means that COVID-19 could have a lifelong impact on your child's physical and mental well-being. Prior to COVID, mental health professionals were seeing a disturbing rise in children experiencing anxiety at home and at school, and now it's getting worse. So pre-COVID, there was a study done by the CDC, and this was in 2014, and it showed that about 12% of kids were experiencing some level of anxiety and anxiety behaviors. And then during the pandemic, there was another study done that was published in the Journal of Pediatrics showing that there was about 3 times higher anxiety rates with kids during the pandemic than before it. So that's a pretty big spike. And with some current research, it's showing that the rates are only increasing. So now you know about the ACEs, adverse childhood experiences. And the rest of the series is how to mitigate the effects using simple, tried and true strategies. And these will cover areas such as self-care, co-regulation with your kids, developing schedules and routines and rituals, identifying feelings and validating them, and also the magic of touch in mental health. If you're catching this series live, check back every week on Thursdays, where it will be continuing to come up live for the next few weeks. Or for more content, you can click through to see the playlist afterwards. So please check out the rest of our social media for MHP in the description, and you can leave a comment on this video and we'll address your ideas or questions in our Community Connections live stream on Facebook at the end of the month. And you can check out the description for more info. In the next week, we will be looking at different ways to continue to help to support children's mental health during COVID. Thanks.